Hi, everybody. I'm very excited to talk about some of the bills that we're going to be watching and engaging with this legislative session. First up is a bill that is our top priority in the health space for this session, which will be building on some exciting momentum from the previous session from 2021. And this is a bill to cover all Utah kids. Utah has one of the highest rates of uninsured children in the nation, and we've seen an alarming increase in the number of uninsured children over the last couple of years. So this is an important bill that will help us get kids back on track and reverse the trajectory we've seen affecting kids and families over these last couple of years. Sponsored by Senator Luz Escamilla, who's been a tremendous champion for this bill and building on just some great work that happened previous session to lift up this issue. We feel like this is the year to cover all kids and to get this bill passed. It will do three critical things for Utah kids. One is it will remove barriers that currently deny some children the ability to enroll in CHIP and Medicaid. And so by removing these barriers so that all children across the state, regardless of where they live, their immigration status, their the language they speak, that all children will be able to enroll in health insurance. This will be an incredible step forward for Utah kids and will go a long way to help families across the state. The second critical thing that this bill will do is that it will also enact a policy of 12-month continuous eligibility. This is something that has been a top issue for Voices for Utah Children over the years, and ensures that children enrolled in Medicaid will be guaranteed 1 year of continuous coverage, regardless of temporary bumps or changes that may affect their parents' eligibility over the course of the year. This guarantees that kids can just have that year of continuity and streamlined care. And lastly, this bill will also ensure targeted outreach, because we know that many children are still unaware of their health insurance options. We made some great headway last session. This bill will build on that and make sure that once the rules change and that more kids are able to get enrolled that have previously been denied care, that they will be able to learn about their options. And so this bill is really important to help families learn about their options and know about changes in the Medicaid CHIP system that would enable them to be able to access coverage. So we're really excited. We'll be sending out lots of information about this. I know Ciriac will be talking about this bill a little bit more as well, because we really feel like this is the year to get kids coverage over the finish line and make sure that Utah covers all kids. A second bill that we are working on and following very closely is sponsored by Representative Lesser, who has been another champion and an advocate for maternal mental health and maternal justice in our state. This bill will address gaps in coverage that pregnant people experience during the prenatal period and also the postpartum period. And as we all know, that coverage is incredibly linked to mental health. So if you're not covered, then it's harder to access consistent mental health services. And so this bill would address the maternal mental health crisis that we are experiencing in our state by creating continuity and coverage for women and pregnant people prenatal through postpartum. What this bill would do is it would increase the threshold for Medicaid pregnancy, because pregnancy does not enable you to qualify for a special enrollment period in the marketplace. So it is possible for individuals in our state to go their entire pregnancy without coverage because they weren't able to access the marketplace. Second, this bill will address the Medicaid postpartum period. Medicaid postpartum coverage only goes for 60 days, but this bill would extend that for 12 months postpartum. And it will also address people that might fall through the cracks when they're transitioning from Medicaid to the ACA marketplace, by putting in some safeguards and creating a warm handoff for people to access the marketplace if they're eligible for the marketplace after after pregnancy and after giving birth. So it is unfortunate we still have many in our state who are experiencing breaks in their coverage during this vulnerable period, or who are just going their entire prenatal or postpartum period without coverage. But this bill would address that and ensure better care and also better connections with mental health services. So very excited to see this bill move forward and appreciate Representative Lesser's terrific work on this. Finally, bills that we are going to be watching that are continuing to come out that are also unnumbered are just bills that that are going to be undermining, bills that we're concerned about that are going to be undermining public health authority. And we're continuing to see that. We saw that last session. We're still seeing some bills this session. And really, as we are still in a surge, still experiencing the pandemic, still trying to keep our kids and families safe, it's so important that we ensure that we have a strong public healthcare system right now. And bills that potentially limit the ability of our public health experts and our public health officials to address and move forward with getting people vaccines, getting people connected with safe care and safe public spaces. That really limits the ability of our kids and families to stay in school, stay healthy, and thrive. And so we will be posting information about that and just keeping an eye on those bills too, because having a strong public health care system and public health care infrastructure is important for kids and families in our state. So we're very excited about all these bills. I'm going to pass it over to my colleague, to Senior Health Policy Analyst Ciriac Alvarez Valle, to talk more about the 100% Kids Cover All Kids bill and other bills that she's going to be watching during this session.
Thanks so much, Jessie. And I'm going to start off with talking a little bit more about our Cover All Kids bill. Just to reiterate, this policy is inclusive of immigrant families. We know that the past couple of years before the pandemic started, there were a lot of issues with public charge and families being afraid of seeking services and programs that they were eligible for. And we saw a rising number of uninsured children, including one of the highest rates of uninsured Latina children. And so this bill will be important in fighting and ensuring that all kids, regardless of where they live, whether they are in an urban or rural area, whether they are, regardless of their immigration status or their income level, that they are all able to access healthcare. And so we will be supporting and working on that bill with Senator Luz Escamilla, and we are really excited and hoping that we can continue to lower our uninsured rate even more, especially during a public health emergency. The second bill that I want to talk about is our community health workers optional certification bill that we are working on with Senator Luz Escamilla. This bill is really important because community health workers have been at the front line of the pandemic, fighting the pandemic and ensuring that families and community members are able to get the resources, programs that they need, from isolation services to knowing where to get testing to even navigating the healthcare system. And this bill would create a voluntary certification pathway for community health workers to support the workforce and ensure that there is some protection to the workforce, and also support the validating their work and opportunities for greater funding for community health workers. There are a number of requirements that would ensure that they have the right competency-based curriculum training, skills, including advocacy, outreach, capacity building, navigating community and coordination, education and facilitation, and professional conduct, and having a basic understanding of medical confidentiality requirements such as HIPAA. It would also require community health workers to have a certain number of hours that they are involved in their community, have a certain number of competency based curriculum training that they've done, and an opportunity for those who have been community health workers for years before the optional certification to grandparent into the program. And so we are very excited to support this work and support the work of community health workers who have been at the front line of the pandemic. And we will also be doing a advocacy day on the Hill on January 26th, Wednesday, January 26th from 3:30 to 5:30 in support of this bill and in support of community health workers. With the pandemic and the rising number of cases, we are keeping an eye out and making sure that when we do this, we do it safely. And if there are any changes, we'll make sure to update you all on those changes in the coming weeks. But for now, we are hoping to continue doing this in person and supporting this community health worker optional certification bill. In addition to these two bills, we are also keeping an eye out on any of the bills that have to do with immigrant families or immigrants in our state to make sure that they are supporting our immigrant communities and not harming our communities. There are a couple of bills that would support greater opportunities for occupational licensing and multicultural students within schools that we are keeping an eye out. And we will have an update on those bills in our bill tracker once the bill numbers are released.